Call to order the Grant County Board of Commissioners special meeting, May 24th, 2017. Please join us for the Pledge of Allegiance and the salute to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I salute the flag of the state of New Mexico, the symbol of perfect friendship among our cultures. Got a one-item agenda this morning, so I'm assuming there's no changes need to come. Can I get a motion?
So moved. I'll second.
Is a motion a second? Is that better? Is that better? That's all I got. There's a motion and a second to approve the special meeting agenda. Is there any discussion on that motion? Seeing none, all those in favor signify by saying aye. 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 Motion passes. So today, we're here to have a discussion with the Board of Trustees of Gila Regional Medical Center concerning a request for proposal. Turn my phone off too.
Sorry about that.
That's all right. Everybody silence your phones if you would. To have a discussion concerning the request for proposal process for the operation of the cancer center at the Gila Regional Medical Center. Let me remind the audience that the people, trustees, and their guests are our guests today. They should be treated with the utmost respect. I know most of you people in the audience, and I know that's how you're going to be anyway. So they were sent a list of questions that came from the public meeting compiled by the people that put on the public meeting for us. I don't know, 4, 5, 6 days ago. So at this time, I'm not going to ask these questions. I'm going to let you guys just go through the list, and I know that there's legal ramifications in certain areas that you cannot talk about. I'm fully prepared. I understand that. I also know that you could not come here as a quorum. There's not time to advertise it as such. I do appreciate the 3 trustees that are here. That's the maximum amount they could have without having a quorum. I'm happy to have the CEO. So at this time, I was going to let any commissioners add to that if they wanted to.
Thank you very much for being here. Look forward to getting some answers to clarify questions that a lot of folks in the community have. And again, I really appreciate you accepting this invitation.
Anybody else? Okay. Then I'm going to turn the floor over to Chairman Jeremiah Garcia. Excuse me.
Can you hear me? Yes. Good morning, commissioners, staff, and community. My name is Jeremiah Garcia. I am the chair of the Gila Regional Medical Center Board of Trustees. And again, I've been asked by the Board of Trustees to make a statement on behalf of all trustees present and the others that could not make the special meeting today. We, the Board of Trustees at the Gila Regional Medical Center, and the staff appreciate the opportunity to discuss approximately 23 sensitive questions or concerns that Commissioner Billings has prepared for us on the RFP for Gila Regional Cancer Center. Prior to moving forward into the questions, the Board of Trustees want our commissioners, county staff, patients, family members, and our community to know our high priorities. 1, we hear you. 2, you must understand, I live it every day too. Because I have...
Somebody that's talking away from you.
Okay. How's that? Oh, can you hear me now? Yes. Okay. Well, as I said, we're here. I live it daily. I too have a family member has been treated here at the Regional Medical Center, Cancer Center. We understand, we're very sensitive, we're very passionate to what has been happening. And today, hopefully, you'll get some clarification on questions that have been asked from all of you. And again, I appreciate Commissioner Caston and Commissioner Edwards for, Commissioner Williams and Commissioner Edwards for having that first forum that took place recently. And but let me tell you, our highest priorities are one, patient-centered care. Number two is, again, our concerns of no interruption in service to any of the existing cancer patients that are actually being treated at this time at a regional cancer center. Number three, if at all possible, I think we stated this during some of our board meetings recently, and during the forum, I think Ms. Gonzalez stated this too, is our goal is to maintain the highly skilled Field Regional Cancer Center staff as it is today, which will help us to maintain a smooth transition as we move forward. Again, there's going to be some real clarification into a lot of the questions that were answered. We have to be patient with us because I have a team of people that will be able to answer some of those questions and not be in violation of disclosures and things like this. So I'm going to introduce first a few that are only here, sitting here, is Dr. Montanaz, is Board of Trustee. He's on the Executive Committee, and he's here today representing Edwards and Medical Center trustees. We have Leanna Ryan, who's our ADPA, that works in conjunction with every one of us when it comes to any activities going on, especially contract information and things like that. Again, I think most of you know our interim CEO, who's Alfredo Lavells. Alfredo will be talking on some of the questions as it is today. And again, we have a trustee who is a physician, and again, on our executive board is Dr. Victor Luchenko. And he will be answering some of the questions when it comes to physician areas. And then again, we do have legal counsel, Carolyn Banks, she's out of Massachusetts. And we also have legal counsel, this is Chris Mayo. Each of them specialize in certain portions of the business that we have to attain to every day. And again, we hear you. I'm very passionate because the future of the treatment that happens to my life is just as important as every one of you. And we have other trustees that are coming through some of the same similar things themselves. So we understand. We're very passionate. But hopefully you'll understand, and as we clarify the questions that have been put in front of us, and it will give us that opportunity to share Gila Regional's reasons as to what's going on. So thank you. I'm going to sit down and we will answer questions. We have mics in front of us that will be available to answer these questions as they move forward. And I hopefully we will go down the list starting from number 1 all the way down. And again, what I would ask is we will read the question, and then at that time we will have an appropriate person respond to the question. Thank you.
Thank you, Jeremiah. So, just go ahead and start throwing. Well, listen, you don't need to stand to talk. Just get the mic close to your face.
Thank you. Can everyone hear me? Thank you. As Mr. Garcia explained, my name is Chris DeMayo. I'm an attorney for the hospital, and I'm going to handle the first 2 questions because the answer is the same for both of those first 2 questions, essentially the same. The first question is, who initiated the change in operations of Gila Regional Cancer Center from New Mexico Cancer Center to UNM, the University of New Mexico? Gila Regional had a contract, still has a contract, with the New Mexico Oncology and Hematology Consultants Physician Group, which is the physician group led by Dr. McEnany. That contract expired on January 1st, 2016. For the next year, the hospital and NMOHC and their lawyer tried to negotiate a new agreement because the prior agreement had expired. We extended the agreement on multiple occasions to May of 2016 and then again to November of 2016, all negotiating on how we were going to get a new agreement for the cancer center. The primary issue that we were discussing was the fair market value for the payments for the services, which is a legal requirement imposed by federal law. The parties, after a year of working on it with their principals and their attorneys, were not able to come to an agreement on how to determine the fair market value. The contract has a provision in it that says when that happens, then one party has to terminate and give 180 days notice, which was done in January of 2017. That was not done lightly, obviously. It took a year for us to get to that point. And actually, in December of 2016, the parties mutually decided that an RFP process where NMOHC would be allowed to submit a bid would be the best process to go forward. So it was a long, drawn-out process with both parties involved negotiating, and they ultimately mutually decided to do the RFP. So in answer to the second question, is there any chance this was personally or politically motivated? The answer is no. There was a year-long negotiation. We did everything we could to keep the relationship in place, but both parties decided at the end of last year that the RFP process was the better way to go. And I'll turn it over to Alfredo or anybody else who wants to add to either one of those.
Just a quick reminder to the commission and to the public that I came on board on 9 January of this year as the interim CEO, and one of my tasks as CEO is to make sure that there isn't any risk to the hospital based on process. So what we're doing now is just following process on the advice of counsel and compliance and moving forward on it. So, thank you.
Just to add to this, again, action is needed to stay in compliance with federal law, and this is why we had to move into the RFP process. And it's so important that people understand we have to comply with federal law as it is.
Absolutely. There's fines, there's prison terms for the individuals involved in very serious matters, that the federal government has detailed regulations about how hospitals and physicians interact, and if you do not comply with those, then it could result in the hospital shutting down for inability to keep its Medicare certification or inability to stay open because of fines and other penalties. So it's crucially important, and that's why it took so long to get to this point, because we have to have compliance on that regard. Okay, we're on number 3.
Okay, we're going to move on to number 3. Okay.
Number 3.
Okay, I'll read this question. Because at least some or maybe a majority of the trustees and the commissioners have concerns, would the trustees be opposing? Can you hear it now? Okay, I'm sorry. I'll rephrase the question. Because at least some or maybe a majority of the trustees and the commissioners have concerns, would the trustees be opposed to having an independent professional review of the process from start to now? Again, that one portion of the sentence, maybe a majority, must say that the trustees do not have concerns about the process once all was completed and the results were disclosed to the Board of Trustees. That caused us to move forward, as we must do under federal law, to have a contract in place. Now, I know there are concerns, and we're very sensitive to it too, because some of us are living it, and we want to make sure that everything is done correctly. Mr. DeMail, do you have anything else you would like to add to that? Or
Well, I think the process is dictated in large part by state law, which Ms. Banks is adept at discussing the procurement process and how that worked.
I mean, certainly, as a county hospital, thank you, sir. As a county hospital, a Gila Regional Medical Center is required by the procurement code to go through the request for proposal process when they, need to enter into some professional services contracts. They do it for the oncology services. They've done it for emergency room services. They've done it for hospital services. They've done it for radiology services. And it's typically a way for a hospital, a county hospital, to make sure that what they're doing is getting good physicians into their community. They're able to get the best quality for the best dollar. And that's what the RFP process is designed to do. And they did it right in this particular instance. They issued a request for proposal. They sent it out to the individuals who might have the necessary skill sets to provide oncology services. They gave it the right kind of time frame. They got responses, and in this case, they got 2 responses. What they also did in the request for proposal is they identified the evaluation criteria. And I think we talked about that. There were 4 things that they looked at, and they told the individuals who were going to be bidding that these were the 4 things that they were looking at. Let me see if I can grab that. So what they were looking at is relevant experience, expertise, and reliability of the firm in the provision of medical and radiation oncology services, confidence that the respondents can perform specific service requirements for Gila Regional Medical Center based on past performance and information provided, past experience in rural New Mexico or other rural communities with the appropriate management plan or approach for a rural community, and then price, which includes cost and compensation. And that's the evaluation criteria that was provided to the individuals who bid. They were also notified that there would be weights assigned to each of those. The cost was only assigned 15 points. Everything else, like the relevant experience and expertise, was 35. Confidence that they could perform was 35, and then past experience was all assigned 15 points. And so when the individuals went and responded to the RFP, they knew what the criteria was going to be. They answered a series of questions, they provided information, and then once both of those proposals were in, an evaluation team sat down and looked at those and scored the RFP, and then subsequently discussed the scores that were generated at that point. That's how you do a request for proposal. That's how you go through the process. They did it right. And at the end of the day, when the scores were tabulated, the University of New Mexico Comprehensive Cancer Center scored the highest. And they were offered the opportunity to enter into contract negotiations. They were the successful bidder. That's how you do a request for proposals. That's how a county hospital does the subsequent request for proposals for emergency room, hospitalist, radiation, or radiology. That's how they do it, and that's how they did it in this particular case. They followed the statute.
Thank you, Carolyn. I'm going to go ahead and read number 4 now. It says, why did the administration not wait until the new CEO arrived on May 30th?
That's mine. I'm Alfredo Oliveros, I'm the interim CEO. So basically, we didn't wait when I arrived, because I was going to be the interim, so we didn't wait when I arrived. The process, in order to keep it going, it needs to be ongoing, it needs to be moving forward. When we come in as CEOs, whether interim or full-time, we're responsible for the entire process, and that's what we're doing. We're not waiting, It'll be my requirement, my responsibility, and I'm accountable for that, to effect an effective transition between myself and Ms. Arias, who is scheduled to take over as your hospital CEO on 30 May. So she'll be fully briefed. The team will be fully available to her, not only our board team, but our administrative team and also our legal team. So there won't be any holdup in the process. It's just something that needs to keep on going, so we don't run afoul of either the federal or the state requirements. Thank you.
Also, to talk about something, all the extended agreements had expired as of 12/30/2016. And then again, both parties agreed that we must move into an RFP process. And so under that time frame and the time frame of the termination of the contract, we have to move on those activities. So just to clarify that, it was very important that we could not wait for the new CEO to come in. We have to take action, take care of the business. The next question is, please explain in detail the process. I think Carolyn did do some detail of the process. It asked here, who was on the evaluation committee and how or by whom were they selected? Who chaired the committee and what was the evaluation criteria? I believe Carolyn was going to talk a little bit and then Alfredo.
I think I've described the process to you and read you the evaluation criteria. That's the criteria by which the responses to the request for proposals were otherwise scored. At the end of the day, the New Mexico or University of New Mexico Comprehensive Cancer Center scored the highest, given that evaluation criteria.
I think on the next one, who was on the evaluation committee and how am I with it? The evaluation committee was made up of board trustees and with and hospital staff. As was published, I sent out a press release on that. How and whom were they selected? They were selected because that was the team that was ongoing in the discussions for the negotiations that didn't go beyond November 30th and December, obviously. We didn't come to an agreement, so we needed to press on, and the people that were negotiating or involved in that particular negotiating were the ones that were also assigned to evaluate. And then, of course, Ms. Banks already discussed what was the evaluation criteria. The evaluation criteria was pretty well set there, and we were briefed on what that evaluation criteria was. So that's all I have.
I have a question.
Go ahead.
Just to make sure I heard you right, you said that 4 trustees were on the committee?
No, I did not say 4 trustees. I said there were board of trustees were on the committee.
Oh, okay.
Trustees and staff.
I didn't say 4.
Oh, okay.
That would have been a quorum, and we didn't.
Oh, okay.
And to clarify that component there, the Board of Trustees asked that the Executive Committee participate in this as a leadership of the team, and so that's why the 3 Executive Committee Board of Trustees were asked to be on part of this, to do the evaluation process. And that, just let you know. Okay.
One other thing on that is because there were questions as to why there were not any providers on the evaluating committee. There was a member of the evaluation committee is a physician. So, thank you.
Okay, we're moving on to number 6. It says, have some of the trustees been more involved than others in the process? Well, yes. I just explained to you, the reasoning is they asked that the executive committee be part of this process. And so we honored what the rest of the trustees have asked, and that's why they were aware of who the team members would be when we moved on to the evaluation process. So number 7 is who specifically was involved in the negotiations with the UNM.
That's mine. That's mine. Basically, the CEO, the CFO, and members of the C-suite team, we have a Form D that's on there. He's clinical. We have the chief nurse who's clinical. We have, of course, myself and our CFO. We're administrative, but we're looking at the numbers. We're looking at the administrative process and the overall look. Okay. Then we have 3 physicians that are on there. We have one who's on the board, we have one who is a representative of the medical executive committee, and we have one who is a physician employed by Gila Regional Medical Center and is our family practitioner. So we've got a solid team. The incoming CEO also has negotiating skills, and will be able to slip right into my role, what I'm doing there. We'll just have everything prepared. We have not really we've met with UNM just one time. It's an initial meeting to set the stage. There are there's issues and items on both sides of the fence that we're doing research right now. We're entering into non-disclosure agreements right now. We're doing all those things to set up the negotiation. But as Mr. Jeremiah has said on numerous occasions, that a contract has not been led. It will not be led until after negotiations are done, if we get to an agreement. And as we said, we went for a year with the current contractor to try to get to an agreement, and we didn't get to an agreement, and that's why we're doing this now. So nothing says that we're going to get to an agreement. That's what negotiations are all about. Thank you.
Okay. The next question, number 8, is who contacted UNM and asked them to respond to an RFP?
I can answer a bit of that. We sent our, and you can help me out, Carolyn. We sent requests out. We sent them out to legal ads. We sent them out to newspapers. We published it. We published that we wanted folks to enter into, to send us a proposal so we could have a good array of proposals to look at. I am not aware of anyone, personally not aware of anyone who requested UNM to send in a proposal. Now, I know that we had someone that said, well, maybe the University of Arizona in Tucson might be one of them. Well, we sent them an invitation to RFP, but they were not one of the people. They were not one of the respondents. We only had 2 respondents. One, the current contractor, Dr. McEnany's group, and University of New Mexico Comprehensive Cancer Center.
And, that's one of the requirements is you have to publish your request for proposal, and the state has a website, and there's other places where you publish the legal notice that you're doing a request for proposal. And then, and certainly you, as part of your ad, you attach the request for proposal, has a draft contract with it, and you make that generally available, and if someone is interested, they can respond. So that's typically what the process looks like. That's the way they've always done it, and that's the way it was done in this case.
And again, apparently what I understand is legal ads went out on the state RFP website. And again, that was February 3rd, 4th, and 6th that it was actually posted into the website. And everybody had an opportunity to respond to the RFP at that time period.
Just one other point. I remember Dr. McEnany giving me a call around that time, asking me if it had been posted, and at that time, I just told her it had, but I also made it a point that we send her the request for a proposal. Now, Most folks that are going after RFPs know where to find them, find the invitation. So in this case, though, I personally asked our staff to send her a request for proposal. Thank you.
The next question, number 9, is many local physicians have expressed concerns with the change. What involvement did they have in the decision, and what involvement will they have in negotiations or approval of the UNM's contract? It is important since they will decide where to refer their patients, either to Gila Regional Medical Center's Cancer Center or outside of the area. And I know Dr. Huichuco, as a physician, will take this question.
That's my question. My name is Victor Huichuco. I've been in Grand County for about 16 years now. I've had the opportunity to take care of a lot of patients, including cancer patients. And it's important for me and other physicians that our patients get the best care, that our patients are taken care of either at Gila Regional or UNM. I have had a lot of my patients that have gone to UNM for care. I have a good relationship with UNM. Some of my pregnant patients who I had to transfer to UNM, I have had a great relationship with them. I talk to them all the time. They talk to me almost every week. So in terms of UNM, personally, in terms of what I have done, I've had a good relationship and a good ongoing relationship with UNM. In terms of the local physicians, during this process, I had an opportunity to talk to a lot of the physicians. A lot of them called me. They expressed concern about the process, about what needs to be done, and of course, they were concerned that their patients get the best care. That was the biggest concern for the physicians. Before the process, I had a long discussion with Dr. Ski. We went back and forth. He called me, I called him back. We talked about the process, what needs to be done, how we're going to take care of our patients. I also had an opportunity just before the final decision to talk to Karen DeGenevieve about the process. And there was a lot of concern by other physicians after the process, after the RFP was offered. So I've had 2 meetings with groups of physicians about the decision. I've talked to individual physicians about the decision. And I think their biggest concern, the physicians, is that their patients get the best care. If UNM comes and becomes the cancer provider, I think it's important that the physicians are involved in the process of the negotiation and the contract process. One of the things we talked about is to make sure, if it's possible, that we keep our current staff that we have now, and that would afford us continuity in the process. So that's an important thing that we talked about working on. Another thing the physicians are concerned about is getting information, being able to get access to patients' information. And we had one meeting with UNM, and this is a process that's ongoing to make sure that physicians are able to get patients' records and information to afford care. Another thing we talk about is being able to work closely with UNM, because sometimes patients may get to the point where they need to be transferred to UNM to make sure that we have beds available for those patients to go to UNM and get care. One thing I'd like to say is that this process was very deliberate. We talked about it, we carefully reviewed the process. As we went through the process, we did not all agree about how the process is going, about who should get a contract. But ultimately, in my mind, at the end of the discussion, looking back, at least from my point of view, I think we made the right decision. And I'm going to continue, while I'm on the board, as a board of trustees, my job is to continue to educate the physicians about the process, to make sure that all the providers on board. But the most important thing is to make sure that our patients get the best care and continue to get the best care, and that their care is not disrupted by this process.
Dr. Orchuko, you also talked about in this process that, yeah, maybe there wasn't numerous physicians on this committee, but we had clinical staff. Can you tell us what, these people and who they represent, because they touch a lot of our patients?
I think a lot of people that were on the panel and committee were, besides myself, we are providers or people who had direct relationship with the New Mexico Cancer Center. There were pharmacists, there were nurses, there was a physician assistant. And during the process which I was involved in, there was deliberate discussion about all the aspects of cancer care. And our goal was to make sure we got the best care and that nobody's care is disrupted. So I think everybody that was involved in the process spent a lot of time. I've probably spent 4 or 5 hours this week having different discussions about where we are going with this. But I think everybody on the board wants to make sure that we get the best care for our patients, that nothing gets disrupted. Remember, some of our family members, some individual board members have gotten care. Besides, we're talking about cancer care today, but there's different cares of Hero Regional. We deliver babies, we do all kinds of care. My 2 children were delivered at Hero Regional, so I'm invested to making sure that we get the best care at Hero Regional.
Thank you, Dr. Orchuko.
Thank you.
Yes, while we're on this subject, I have a question, and I don't know that can be answered, but so talking about physician involvement, there was some sort of, and I've had a hard time getting a handle on this, but there was some sort of a vote of no confidence, supposedly, maybe?
Medical Executive Committee.
The Medical Executive Committee? Is there anyone who can speak to that from the audience, or is that all?
What I could say is that the physicians, I told you I had 2 meetings with 2 groups of physicians, and their biggest concern is to understand the process. Why was the decision made the way it was made? So I had 2 different discussions, and as this is evolved, I think most of the physicians are beginning to understand the process and why decisions were made. I don't know if that answers your question.
I guess my question is, let me piggyback on that, Commissioner. Had there been any kind of documentation coming to it, I would have received it, and I have not received anything. Okay, thank you. Thank you.
I can speak to that.
Let's let him finish your question.
Okay, we're going to move on to number 10. Why was it announced that UNM would be coming to Hilo Regional before the trustees have approved a contract under the RFP process? Carolyn, could you help us on that one?
I'm sorry. Typically, that's what you do, is you announce who is the successful offerer, the person who essentially scores the highest. You announce that, and then you begin the negotiation of the contract. That's typically what the procurement code has you do. So it's one of those things where you typically have to announce who is the successful offerer, so you can give notice to both individuals. In this case, both individuals, or in other cases, all of the individuals who have submitted a response, and then you announce who essentially has the highest score, and then you move forward with the contract negotiations. I think, as I mentioned, there's a draft contract that has a lot of the terms of a basic contract included with the request for proposal, so that the individuals who submit responses have some basic understanding of what the structure of your relationship. So that basic information is out there, and then you start filling in the blanks and negotiating. And I got a sense that most of the negotiations are really operational things, like how are we going to do this? How are we going to transition? So that's kind of where we're at. But I have to say that that's how you do it. That's how the procurement code requires you to do it. Give notice who's selected, and then begin your negotiations. Thank you.
Thank you, Carolyn. number 11, the transition is a complicated process. How can this happen before the end of July? And when a contract has not even been negotiated with UNM? It's a good question. Dr. Wells?
Let me start with that. As I said, we had an initial meeting last November 11th. At that time, there were issues regarding the transition. So what we have to go back and do is review those issues that include, how we're going to take care of our radiology oncology patients. And then during the transition, if there is a transition, remember, it's not over until a contract is signed. But the thing about it is, in the contract, we have to plan that we are going to go forward with a respondent, because that's what we're obligated to do. It doesn't mean that we're going to get there. Remember, we worked a year with Dr. McEnany and didn't come to an agreement. So let's keep that in our minds. So there are issues that are coming up, and yes, we're going to have to discuss with Dr. McEnany some of these transition issues, because not only is it the transition of patients, but it's also the transition of some really serious, at least significant administrative issues like records, especially records, processes in ordering chemotherapy and drugs. There's a lot of issues that need to be determined on that. So it is a complicated process. Unfortunately, the legal requirements from the feds said that we needed to do that termination. So that termination gave us just 6 months as a holdover on a stark, potentially serious stark issue, okay? So now what we have to do is determine how long that transition period really, how long will it be, and then work with Mr. DeMayo and Ms. Banks to come up with an appropriate legal vehicle that will cover us from risk on Stark, and yet allow us to potentially extend the transition period with the current contractor providing services. Now, that includes Dr. McEnany agreeing to all this. So we're in that process right now, and I think hopefully I didn't share too much.
Our goal is to have a smooth transition, and that's our goal. And the primary goal is to make sure we have good continuity and patient care. I mean, that's the primary goal. We know that this process may be complicated, but our goal is to make sure that it's a smooth transition. We are hoping that we can keep the current staff as much as possible, depending on the processes. And I think if that's possible, that will allow for a smooth transition. But our primary goal, the negotiating panel, our primary goal is to make sure that there's a smooth transition, that patient care is not affected. And I think that's and it's going to depend on what New Mexico Cancer Center and UNM, how they work together to be able to allow the transition. But I think our goal is to make sure we continue to do that.
Just one point of clarification. We do have some flexibility beyond the 6 months under the Stark Law, and we're dealing with the legal issues on that right now. But the goal is goes beyond the legal issues. It's the care, and so we're dealing with the legal issues. But to Mr. Ontiveros' point, we can't have an expired contract out there forever.
So this would be a short-term contract, correct, Mr. Mayor? Of some sort?
Yes, we would, with as much as we can within the law, we would bridge the gap if there is any.
Okay. Thank you. The next question is, how many patients does the Cancer Center actually treat? What is the number reported to UNM?
Okay. The request for proposal, which I think the county commission asked for that, and I think we provided it to them, correct, Carolyn, had a lot of numbers, a lot of information in there regarding numbers. But let's just quickly here. There are the number of currently treated patients is approximately 160. 35 of those are radiology oncology, 130 are 125 are medical oncology. The radiation beam average is 4 to 6 patients per day. chemotherapy treatments average about 6 to 10 patients a day. Karen the Genovese sees about 6 to 13 patients a day, and when the physician is there, they see about 16 to 21 patients a day. Am I getting into proprietary information? No, that's my information, right? Yeah, that's fine. Okay, I just want to check in. So, as you can see, we average only 110 to about 120 new patients a year. And one of the discussions is going to be in the, we had sorted that out with Dr. McEnany. But one of the discussions with UNM is we're going to have to determine their model here, because 120 new patients will not pay for full-time services here, okay? It won't pay for it, and we'll have to adjust that. So not only are we looking at our primary goal is to take care of our patients and have a smooth transition. That's our primary goal. But the other goal is fiscal for your hospital, for our hospital, is to make sure that we get a fiscally sound arrangement. Thank you.
Thank you, Mr. Montevideo. And I thought we were talking about some numbers pertaining to, they may have treatments or so many patients, but they have numerous treatments. And wasn't that about 9,200 or something like that? I think what we had stated into the contract, I think.
I think Carolyn can run the RFP.
In the request for proposal, the people who bid on the proposal were given some specific information about Gila Regional Medical Center and also given some totals for number of visits. And what they said is that the Cancer Center administers approximately 9,200 chemotherapy and radiation therapy treatments annually. And that was the information that was provided to the individuals in the request for proposal.
Thank you, Karen. So there's quite a bit of activity in the Cancer Center when you look at that amount of treatments that are being done during the year. The next question is, will UNM provide a full-time oncologist or locum tenens physician? Can you talk about the plan?
Yes, during the RFP process, there was a proposal by UNM to at least have one oncologist that's going to live locally, that's going to be local. But I think the final decision will decide on the negotiations and depend on the number of patients that we have. But they are promising that they will at least have one physician, one oncologist that's going to live in town.
I'm sorry, I didn't hear that.
Yes. UNM, during the RFP process, they were saying they will at least have one physician that's going to stay here locally. But the final decision will depend on the number of patients and the negotiations. But they are offering to at least have one physician in town.
See, the way they propose this is we're looking at actually a community member living here in this community, being a member of this community 365 days a year. They look at a 1.5 plan, meaning that when that physician either has to go to training or has vacation or is sick, they will make sure some other physician will be down here taking care of those existing patients. And that's kind of the model that they're looking at right now. But they want that physician to be a local community physician. And so 365 days a year, 24 hours a day, if there's any emergencies or anything, there's not a wait time period. They can be immediately contacted to take care of a critical patient. And that's the plan.
In our initial discussions with UNM, we broached the subject of them taking on our staff, or letting us access their staff, including Karen Genovese as the advanced practice nurse, and they verbally agreed to that. I also got an email, and it's not under non-disclosure, so I can say that. Basically, they said it might even be better if you, GRNC, employ those non-physician staff, which would mean non-physician staff, which means the thing that I went back to them and said that I would want UNM, if UNM is the one that is to also take on the highly technical positions like the physicist, the radiology dosimetrist. Those folks are highly qualified, highly technical, and it could be, we might not have an ability to source those as they left us. I would rather that they did it, so that's what I sent back to them. So, anyway, so be it.
Thank you, Mr. Montiveros. Number 14, if the cancer center is a large generator of income at the hospital, will this continue under UNM? And how can we be sure? Yeah, it's yours.
14, okay. It is a large generator of revenue, but revenue is simply a gross number. It's not really what we get paid. The cancer center operation the cancer center operation minus the chemotherapy drugs is actually runs at a loss. I don't know, I only had a chance to look at this year's, but it's actually running at a loss. Now, when you add in the chemotherapy drugs, then that brings us up where it does generate some positive revenue. And that's been an issue here, trying to get the actual number, and I don't know if when Mr. Caston was on the hospital board, trying to get the number has been tough, and I'm working on it. And I plan, myself and Jo Beth Vance, who is the interim CEO, we plan to have those numbers. It might be before I leave because they're working on it, and it might, but it sure will be before Jo Beth leaves. And so those numbers will be there. But my understanding as I see the operation, we're losing money on the operation, we're making money on the chemo drugs. I just don't know how much money we're making. But those of you that see our financials, it's not taking us to the bottom line of $2 million or $3 million or $4 million. The bottom line is simply, barely, what can I say, break even at best. A few $100,000 maybe get to the positive since I've been here, but not a very, it doesn't cause us to be to the entire hospital to be significantly positive. If you can, did I make myself clear? Okay, thank you.
Okay, thank you, Mr. Montiveros. The next question is, the cancer center was working for the community so well for so long. Why did we decide to change this? And this will be Mr. DeMeo will answer that, and it kind of starts with like what the first question was.
That's right. It goes back to my first point that I made when we began this. The contract with New Mexico Oncology and Hematology Consultants expired in January 2016. So we've been working with them for a year to try and keep that relationship going, and the parties were not able to come to an agreement, unfortunately, and mutually decided to try the RFP process instead.
Okay.
Can I just add just a tidbit there? When I got here on 9 January, I got a call 2 days later by Dr. McInerney. He wanted to see if we could negotiate, and by that time, the process that was already in place, I had to tell her, obviously, I had to tell her no, and then there were certain things that I couldn't reveal as the process went on, but you need to know that.
So just to be clear, if I'm hearing you correctly, well, when you were in your negotiations with the Oncology Center, New Mexico Oncology, they agreed that you should go to the RFP process.
It was mutually discussed, and the comment was perhaps the party should go to the RFP process. Now, to the extent that there was a written contract that we would do that, there was no written contract that they would do that, but in the negotiations back and forth, yes, both sides had come to that conclusion that was probably the best way forward.
Well, I'm totally shocked she would do that, but I'm sure she did. Thank you.
Again, Commissioner Caston, prior to the board wanting to move forward on RFP, that was one of the questions we asked our legal department is this a true agreement between the two parties? and before we can move forward on the RFP. And again, through some of the documentation and everything, we could see that, yes, we didn't want to move forward until we knew that New Mexico Hematology understood that we were moving into an RFP process. And that was very important before the board said, let's move forward. Next question. Will UNM draw people out of the community to their facilities in Albuquerque?
Our goal is to keep patients locally in town. There's going to be some situations when a patient needs to go to UNM to get advanced care, but during the contracting process, our goal and our discussions would be to do our best to keep patients locally as much as we can.
Thank you, Dr. Uchuko. Number 17, was input sought from patients for the cancer center? And again, we have to say no. Again, people must understand that Gila Regional Medical Center has numerous physicians and clinical staff that obtain privileges via the credentialing, MEC, and again, the board approval. Any service that we provide at Gila Regional Medical Center, there's a process that must be in place. Just by example, as I explained, my wife has been a patient for over 3 years, 3.5 years. And again, when you sought for patients' input, during this process, my wife has had 3 oncologists. No, we don't ask anything other than to accept that Gila Regional Medical Center and New Mexico Oncology have done their due diligence to make sure they have adequate physicians in place to take care of things. My wife was very concerned. She said, this is me, this is my life, and why am I having another physician come in to take care of my treatment? And talking to other physicians, the treatment is already established within any part of Gila Regional Medical Center. And by example, if Dr. Uchuko had to leave and he has his patient, he will have another physician. If he was sick, something happened, there's been an accident, like some of our physicians have had before, someone will take place and go through that treatment process. To me, to explain to my wife that she's not a guinea pig, she's not anything, we have great physicians that will take care of you. We have to have trust in the way the system works. And so when you ask for input, we all have choices of physicians that we go to. Me as a patient, you as a patient, all of us live a life that we have to look at things. But as far as when you ask input, anytime there's a change in physicians within our community, we've never asked for input. We're looking for the best of the best to come in and provide a service. And that's what I had to explain to my wife to make her understand. We're okay. We have to trust that the service provider, as well as Gila Regional, are doing their due diligence to make sure we have the right team in place to take care of our patients. So please trust that we are getting the services needed for each of us as a patient. And my wife understood and knew this was her life, and she just wanted the best of the best. And I said, look, I'm telling you, the treatment will not change. It will be the same treatment. Dr. Uchuko, could you kind of talk about patient care and treatment?
I'd like to add to that, and what I'd like to add to is sometimes because of the rules, it's hard to, unless the patient approaches me, it's hard for me to approach a patient and ask them what's going on with their health. They have to approach me to ask me questions. But in addition to that, I had opportunities to talk to several providers before and after the RFP process, and they expressed their feelings about the process. So there was a lot of input, not directly from patients, but there was a lot of input from doctors and other providers.
Okay. Thank you, but, when we go to patients, you need to understand, anytime a new doctor comes into town, if we have an input, when they don't know them or one's leaving, we can't. It's part of life, retaining a physician in place or recruiting a physician. It's the duty and the business side of what our Gila Regional Administrative Team must do, and the medical staff, as the MEC, as the credentialing department. All of them have to have their ducks in a row before privileges are actually given to any physician that comes into our network. And again, our cancer center physicians have all qualified under those processes, and they will continue as life goes on. We will continue. It's a process. It has to be in place at all times. So, that's why when you talked about, input, it's a very sensitive question. And I understand, why that one was put there, but I live it too. And again, I really feel that we all need to understand there is processes in place to guarantee that we have the best of the best there to continue the ongoing treatment that any patient has identified or been put to task with. Now, number 18 is we have gotten significant feedback from the community and patients that they are happy with the services now provided and feel that this will be a negative disruption in their treatment. Is there any way to walk this decision back? Dr. Huichuco, can you kind of talk about treatment and, again, disruption of treatment with the plans in place already?
Have we gotten some feedback? We've gotten a lot of feedback. And like Jeremiah said at his initial presentation, we've had from a lot of physicians, we've had it from a lot of providers, we've had from a lot of community members. So, and we are very, very, very sensitive to those feedback. It's part of our job to make sure that patients are comfortable and getting the best care. The process, the way it works is that the RFP process has started, and you can't just walk back. I mean, UNM has been offered the RFP. We're going to go into negotiations with them. During that negotiation process, it becomes so important that we demand that we maintain the current care that we have now. Hopefully even better, than what we have now. But it's important that, as a physician, that I ask UNM to make sure that all our patients are taken care of and that they are comfortable with their care. So in terms of walking back, probably not, but our commitment and obligation is to make sure that we provide the same level of care.
And Mr. DeMeo, according to the contracts, as we transition, doesn't the contract state that we must not have any interruption in service to the patients from the existing contractor?
Both parties to the contract are required to exercise efforts to make sure that the transition is smooth, and those should be made in good faith. And so, yes, both parties do, both the hospital and the current provider, New Mexico Oncology and Hematology.
And again, I believe that under this basis, the treatment that has been designed for each of these patients will be followed through with the existing service provider, correct?
Well, I think that's going to be part of the negotiations, as Dr. Huichuco said. The part of the negotiations is that if we get to an agreement, that there's a smooth transition. If we don't get to an agreement, then we need to figure it out. The question of, is there any way to walk this decision back? The only decision that we made is to do the RFP and to select one of the respondents. We have to engage them just as you would in any of your contracts. I think Carol can address to that. We cannot go back and reestablish criteria. We cannot go back. We would be at risk for UNM to file suit. We just have to run the process according to the book. And I think that's what we're doing. Carolyn?
And that is right. That is how it is. You establish the criteria when you send out the request for proposal. If you change it now to say that, patient preference or physician preference or something else should be used in the criteria, you violate the procurement code. That's the bottom line. You violate the rules that basically allow you to do that. So we need to finish up. We need to go through the contracting process, make sure that we have a contract in place and move forward. And that's where we're at this point. We can't go back on the RFP. We're just not at this point. If so, we'd be in violation of the procurement code.
Again, I'll still state that, again, the patient treatment, the patient-centered care is the highest priority during this process. Just to, make it clear to everybody.
Mr. Chairman, may I make a point just for clarification?
Just for everyone's understanding, these questions, it may be a little misleading because I noticed down at the bottom it has my name. I didn't submit it in that form. I never put my name like that, so I'm not sure who attached my name to it, but I just want to make clear that these are not my personal questions. I wouldn't, as a commissioner, have authority to ask these questions. These are questions that have been posed by community members, and these questions are coming from community members. I did ask these questions on behalf of those people. These are not my questions. Thank you.
Thank you for the clarification, Commissioner. Number 19, 34 to 35 people who spoke at the public forum were in favor of the no change. Only Gila Regional Medical Center's CEO interim was in favor of the change.
Stop there, please.
Okay.
I'm Alfredo Ontiveros. I was at the forum. I was the first one that spoke. I'm Alfredo Ontiveros. I was the first one that spoke at the forum. I did not say in any of my comments that I was in favor of that change. All I said was that we were going to move forward with the process. There is a process. My responsibility as CEO is to make sure that there is no risk to the hospital, and that's what I was doing. I did not make a comment, so I just wanted to go for the record, sir. Thank you.
Thank you, Mr. Ontiveros. Have the trustees had an opportunity to read coverage of the forum in the Silver City Daily Press or in Grant County B? Yes, every trustee has had the opportunity to review all of those. We all review the forum coverage, and it was very important because a lot of it was sensitive information from a lot of patients out there. And yes, we understand. We hear it. We understand. And we didn't push it to the side. A lot of our trustees were very passionate to read what had happened and see some of the activity that was going on. So yes, all of us had an opportunity to review that information. Number 20, was it presented to the news media that this was only a recommendation of the committee and certainly that no final decision has been made, while in fact negotiations were already underway? Mr. Ontiveros?
Well, I think that we have representatives from the media that attend the board meetings. I think in the board meetings since this RFP went through, I think the board has made public comment that says that it's not over until it's over. It's not over until a contract is signed. And I think it's a matter of record with both of the news media that are here now. So yes, it was presented to the media that way, in my opinion. Okay?
And again, 21 stay in compliance with federal law and have tried to attempt to complete a negotiation process of the contract, right? Correct, Mr. DeMille?
Yes. Yes, of course. We can't have an expired agreement out there indefinitely.
Okay. Thank you. Now, question number 21. Do you understand why patients in the community are feeling misled? That's a tough one. And that because, again, under an RFP process, I believe we cannot disclose the numerous things that happened during an RFP. The only thing we could see out of this was, again, what was put in the papers. again, we as trustees demand or request from our administrative team, including our CEO, that we must try to find the best service provider that's willing to serve our hospital at all times, and every component of our hospital. When we look at our hospitalists, our ER, our flight service, even our food vendors, we have to try to find the best of the best that we can at all times. Feeling misled, it's hard to say that maybe we have a contract that we're trying to negotiate, but we're not having any success on it. And that's where it brings back into our legal department as to, what are the next steps we take. And, Mr. DeMayo, has talked about that a little bit, and I don't know if you want to state anything more, but we do the best we can as a hospital. And again, it's part of the business. So,
let me just, there's a couple of things here. There are certain things that we cannot disclose, and that's why we have Mr. DeMayo and Ms. Banks here. And I think Ms. Banks can address those things that we can and can't disclose under the RFP process, and then Mr. DeMayo can, he's got our back on the federal regs and things like that. So there, I heard a call to action at the forum about, there are going to be a lot of people coming to the commission wanting to be on the board. I think those people are going to have to do some research, because being a board member of a hospital is not as easy as you think. As Mr. Caston's smiling over there, it's not as easy as you think. There are issues there. There are issues there so significant that you could be brought to bear individually responsible for certain things. And some of my colleagues, CEOs, have gone to jail for doing certain things. So it's not easy to run a complex hospital. Even a small hospital like Gila Regional, we still have to abide by all the rules and regulations that are out there, everything out there. Otherwise, as Mr. DeMayo says, they could pull your Medicare certificate, and then where are we? 60% of our people are Medicare. Where are you going to go for your care? They shut that hospital down because we didn't follow rules. Think about that. Thank you.
Thank you, Mr. Ontiveros. Number 22, can the trustees be polled by hospital administration to see if any of them support this change? Again, that answer would be no. No. You must all understand the expired contract forced us to move into an RFP. So the change was needed to stay in compliance with federal law. When we look at this, it was an action item that had to take place. And again, just like Mr. Ontiveros said, we have to protect the hospital. We have to protect our patients. We have to make sure that we're doing our due diligence at all times. So when you say can we be polled, I think you've already heard we are in support of what needs to happen to stay in compliance. And that's really the bottom line is we have to comply with federal law. Mr. DeMayo, did you want to add anything to this?
No, I believe we've made pretty clear one of the motivating factors in eventually having to part ways after a year of trying to make it work was our concerns over compliance. And so that we have done this with a focus from the legal perspective of complying with federal law. And that's not to say that New Mexico Oncology and Hematology Consultants does not want to comply with federal law. I'm not saying that. What I'm saying is the parties couldn't come together on an agreement under those circumstances, and so we decided to do the RFP.
Thank you, Mr. DeMayo. The last question was, what was the dollar difference in the proposal? And that, that cannot be disclosed, correct? Fair enough? Right. Number two, again, it was only a component of the RFP. With only a 15-point value. Other areas which were more higher in point value, the cost was not the overall factor in the choices of the vendors. It was the overall weight score that determined the award of bid. Would you agree to that, Mrs. Banks?
That's certainly how I looked at it. And I read you the criteria, and I read you the weights. Cost was only a component of it, but it was only worth 15 points. That's it. I mean, the other criteria were the most important criteria in terms of clinical experience, clinical care, ability to work in rural communities. And that's really where the weight was. And that's how they were scored. So, thank you.
Thank you, Mrs. Banks. This completed the question portion of your request. Mr. Chair, I turn it back over to you, sir.
Thank you, Mr. Chairman. So we'll move into the next portion of the meeting. I'm glad that you guys brought up the portion on duties and responsibilities of board members, because we too have those. And one of the things that we could get in severe trouble for is tampering in a procurement process of an autonomous board, even though we appoint that board. So you won't see a commissioner, I don't believe you'll see a commissioner, step outside of his prescribed duties as a commissioner and take those bullets on his own, because more than likely you're kind of in a bad position here, because it doesn't matter who gets this contract. If you did that, the other one's probably going to become litigious very quickly towards anybody that tampered in that. So that being said, I think what we'll do, and just to explain to the audience the decorum of a commission meeting, if we're going to let the audience speak, but who you're speaking to, because this is a commission meeting, this is not a Board of Trustees meeting, who you're speaking to is the commission. If you want to go ask questions of the Gila Regional Board of Trustees, the proper place to do that would be Friday. I know that they're preparing for you. You're more than welcome to use our room. I know that you probably don't, but you're still welcome to use it if you think you need it. So I think at this time, if anybody has any comments to the commission, we'll just start by raising our hand. But first, I have a commissioner that would like to say something.
Just as a point of order, as it were, I had some follow-up questions to their answers.
I was going to do that
Shall we do that
immediately after. And we're only going to do public for about 15 minutes. The hospital has a prior engagement. They had it prior to us calling this meeting at 11. So at about 10:45, they're gone. So we're going to do this for about 15 minutes, and then it'll leave us about 15 minutes to ask some questions, and the meeting is going to be over at that time. So a few people from the audience, if you want to address the commission, this would be the time to do it. Please.
Should I face this way or that way?
You can face whichever way you want, as long as the light's lit.
All right.
Is the light lit?
All right, my name is Laura Davenport-Reed. I'm an internal medicine and pediatric physician. I'm on staff at Gila Regional Medical Center. I work for Silver Healthcare, and I've been in the community for 15 years. A couple of things I wanted to bring up that weren't asked today, and I appreciate everybody coming here. I appreciate the members of the board that are here. I appreciate Mr. Ontiveros coming again, and I appreciate the patients and the community members who have decided to make this an important part of their day. But one of the questions I had was concerning the RFP process, the policies and procedures that may or may not be in place for an RFP process for a county, and the procurement rules for how this process is followed. I'd like the commission to maybe look at that process, because at the community meeting last week, we discussed that it was maybe a good idea to have this community forum and discussion before the process even started, and also to speak to what Dr. Wachuku said about canvassing some of the medical staff members. I don't think that happened in the appropriate way. I think there are many opportunities and forums for that to happen, and I think it didn't happen in the way we expected that it would. We have a general medical staff meeting, which includes all of the medical staff. Those meetings are held quarterly. It could have happened at one of those meetings in the past, year, but this was not brought up and discussed appropriately at any of those meetings. We have many other committee meetings. We have many other department meetings at the hospital that certainly could have been an opportunity for this to happen. So I'm talking about as part of the RFP, not the proposal, but in your policies or your procurement rules, if you would consider having, as part of that I guess on the front end, looking at community input, looking at medical staff input, looking at community provider input, looking at patient input and family input before the process even starts. And I think that's something that's very important to include as part of that whole process. And then the second part of it, and concerning the question about the medical staff is, yes, there was a vote of no confidence by the Medical Executive Committee. It probably did not make it to a vote at an official meeting. But after the press release, general medical staff was asked to attend an ad hoc meeting the following day. And at that meeting, Dr. Corey, who's our chief of staff currently, canvassed the Medical Executive Committee members, and the vote was unanimous for no confidence for the whole process. Okay? Thank you.
Just so you know, it's not part of the commission's duties to set up RFP responsibilities for the hospital, and we won't do that. So is there any further public input? Yes, ma'am. This is my favorite 8th grade teacher ever.
Thank you, Brett. You're one of my favorite pupils, too. Okay, No, I do. I think everybody here knows that I tell the truth, and that's why they're going to believe what I say to you right now. I do want to thank you, commissioners, for us being able to say what we want to say. I, again, appreciate the eloquence of the trustees' manner of speaking. I'm not sure that I agree with what they've said. I have many questions. Anytime that you ask a direct question as to amount of dollars, and it is not answered directly, we can't disclose that. But anytime you're talking about money, I'm sorry, there's an underlying something going on. And again, my husband was a cancer patient. We lived in the center for 8 months. I know how that center functioned. I don't care what anybody else says about patient care, about transferring this or transferring that. I'm sorry, people, it's not going to happen. It's not going to work like we have it now. My husband first went to the University of Arizona, where he got excellent treatment. We came back here because of the mileage. It was taking its toll on him. My sister was sent to the University of New Mexico. You can ask me later about the care she's gotten there. I just want to say that if my husband were alive today, we would go back to Arizona, not to the UNM. Thank you.
Thank you. Yes, sir. Go ahead. Please state your name for the record.
My name is Ron Henry, and I've been a patient at the Cancer Center for 10 years, so I know it very well. I agree with everything the previous speaker said. My question just simply is, when you looked at the criteria, the ones that you mentioned, there's no way that I can believe, or any of the people in this audience can believe, that UNM scored higher on anything except finance. And if it has to do with dollars, then we're not going to get the same care that we've gotten in the past. So I just want to make, I wish that you could reveal, but you're saying that you can't, what the scoring was, but I can tell you, you couldn't score UNM, which is an unknown factor, higher than what we've had for the last 22 years, unless it was financial. That's all I have to say.
Thank you. Yes, sir. Yes, sir. Please state your name for the record, sir.
My name is John Coleman, and I'm directing this to the county commissioners, as you suggested.
Thank you.
At no time in any of this process was any, to my knowledge anyway, of the cancer patients that are directly involved in the treatment, at no time was any of them asked for any of their input whatsoever. It's like we're a non-entity, and it's just something that's being tossed back and forth. And I'll tell you for a fact, we deeply resented the fact that we've been shut out of this process. It's not fair, and we don't believe we're getting adequate representation from you people by not allowing us to take part of this process. And that's what I wanted to let you know.
Thank you. Back to the room. Back to the room. Oh, no. Come on up. Whoever. Go ahead. Yes. Good morning.
Good morning. My name is Linda Nichols. And as we move forward, if this actually goes through, I know there will be a lot of people that do stay. They may not be able to make another choice. I, for one, will go to Albuquerque to be treated by the people that have taken care of me so far. So my next step in this is to talk to Boutique Air and see if they will offer discounted rates for the ones of us that want to fly up. For the people that need to spend the night, I'll be talking to hotels to see that maybe they can get a group rate. And so moving forward, this is something that I think is important because it's going to take revenue dollars out of the town of Silver City. It is inevitable when we go to another city, we'll be spending our money there instead of here.
Okay, now the lady in the back there.
My name is Orfa Gonzalez, and I have had a lot of public experience on what is happening and how it's happening with other boards. I have 35 years of experience in serving in boards, mainly in education and in the committee, in the city. I've been part of different kinds of boards. Right now, I'm on the board of the Housing Authority, and we deal with stuff like this. The main reason that I am here is because I have been a patient there at the Cancer Center for 9 years. I would not be here if it wouldn't have been for them. When I was diagnosed with cancer, they told me 3 months because I had inflammatory breast cancer. That is the worst. When I was told that, and they told me, the doctor told me, I only had 3 months to live. But I had the best care that anybody can have, and we have it here. I don't understand how New Mexico Oncology rated lower, other than, like everybody else says, financially. And I'm going to reiterate what they have said. Are we going to get the care that we deserve and need? New Mexico Oncology has given us what we need and more. And when I say more, it's because Karen, Dr. McInerney, and Dr. Fontaine, and all the other doctors, and not to exclude radiation. Cito is so good. He is the best. They all take care of us. I don't see how UNM has rated higher other than financially. When you get somebody that will cost less, that means to me that my treatment is going to be less. That the care on a one-to-one basis that we have with these doctors and the nurses, I mean, I feel that I'm not going to be treated as well. If it's money, things don't work out sometimes. It's better to pay more and get the best than to pay less and not get it.
Thank you very much.
Thank you.
Okay, we're gonna move into the commissioner question portion now, and I'll start with Commissioner Brown.
To be quick, there was one piece of a question that you all didn't answer, and that was if you would be opposed to an independent review of the RFP process so that we can feel assured that what you're saying is correct, that all the procedures were followed properly, notice was made properly. Do you have any problem with that?
Do they want to get back to us on that? Or you're not? We'll see what they come up with.
Yeah, Commissioner, typically that's simply not something that the procurement code allows. I mean, it's just not in there.
Okay, so her response was the procurement code does not provide for an independent review, and I understand that. I'm not saying it within the code. This is a public body. We want to be assured that the board is acting correctly. We wouldn't be asking for it to be, to replace the protest process that's going on. We'd be asking for it as an information gathering process for us. And Mr. Ontiveros is very interested in adding something.
I just sidebarred with Chairman Garcia, and I think we could discuss later with Ms. Banks. I would, if I was going to stay on with you guys, what I would recommend is that after the process is finished, that we would take another look at doing an independent review. Would that satisfy you, Commissioner Brown?
I'm not sure, but I appreciate your response. I'll have to think about that.
All right, because that would be, right now, that we can't change what we're into. But at the end of the process, then you could look at it. We could look at it.
And of course, I'm not asking you to change anything.
I know you're not. I know everybody wants to avoid the risk, okay? Well, I'm just trying to answer your question that we would, or Gila Regional Medical Center would be willing to look at having something independent review at the end of the process, which would be either the completion of a contract with UNM or not.
And I guess, from my perspective, the request for proposal lays it out. It gives you when it was issued, it gives you when the responses were due, it gives the criteria for the evaluation. When you can look at the request for proposal itself, and you have the responses, and that's what...
I would mention that you can do that because you're an expert, and we can't necessarily do that without some assistance, so that's what I'm proposing.
Also, to tie to that, maybe Karen can clarify that, but again, we're still going to be under negotiations. If somehow we cannot complete a negotiation with UNM, doesn't it go back to an RFP, has to go back out, correct? And that's the process. It doesn't mean we move back to the other vendor that was not awarded the contract. We have to go back and reestablish the RFP process. And then, just to let you know, there's other things that should take place.
the other, if it was 3 or 4 vendors, like there typically is in a construction project that only you do, I mean, when the top person goes out, then you go to the second person and the third person and the fourth person. But we don't have that here. The second person is the person who couldn't negotiate a contract with. So we'd have no choice but to go out again. That's the problem. That's why this was a more difficult request for proposal, simply because we had to do it, and because we couldn't get a contract with someone who had been awarded the contract previously. That's the issue.
Thank you, that's helpful.
You done?
I'm assuming that for questions, and I don't want to hog it all.
Commissioner Billings?
Well, I thank you for coming, and you've answered a lot of my questions, or the questions that have been asked. I think people are going to leave here with more questions than they came with in many instances. I guess I just want to spend the rest of my time saying that unfortunately for me, and I'm frustrated, because the county commission, and this is not the way I want it to be, this is the way it is. The county commission has no authority over the Board of Trustees other than that we appoint the Board of Trustees. It's a difficult concept for people to understand, so they're thinking because Gila Regional is owned by Grant County, the citizens want the county commission to take action or to be able to do something about this. And I'm still getting emails and calls from people. A former commissioner called me the other day, and he said the trustees are at your pleasure. They work at your pleasure. You can release them if you want. And that's not true. It's just simply not true. We appoint the trustees, and then it's hands off. We cannot interfere in the day-to-day operations of the hospital or into the trustees' business. The commission did not host the forum the other day. 2 commissioners acting independently hosted that forum because we felt like people had some questions that they wanted to air and get asked. I'm glad to hear that the trustees have had an opportunity to look at those questions. I'm glad that we were able to have this meeting and more questions were asked today. I will leave here with more questions. But I needed to make that clear that the commission has no authority other than to appoint. And then the final thing would be there will be some appointments of trustees coming up. You can go to grantcountynm.com, and right there on the front page, the web page, you can apply. There's an application, and if people want to apply, those will be accepted till June 5th, is my understanding. Thanks.
Thank you. Commissioner?
First, I would just like to thank the Board of Trustees and Mr. Ontiveros and the attorneys for coming today. We appreciate you answering our questions. I would agree with Mr. Billings that I think people are probably going to leave here today with maybe more questions than they arrived with, and a certain sense of dissatisfaction about being left out of the process. But I do appreciate the effort to be more transparent on this process than has happened up until now. So, and I want to thank the audience for being here, and thank you all for continuing to bring your concerns forward. This is a very, very important process, and this is the beginning of how change happens, is to participate in the public process in this way. So thank you very much.
Thank you. Commissioner?
Also, thank you very much for showing up today. You know, being that we are in the RFP process, I don't have any questions for you. But I'm sure, like everyone else, after the RFP process is over, we're going to have plenty of questions, and hopefully we'll get some answers that we're seeking at that point. I do admire all of you for serving on the board, and I really do thank you for that, because it's an unpaid job, it's a hard job, and you put a lot of hours into this. And that just dedicated time, especially the doctors that are serving, you're losing out a lot of money by being here, and we appreciate your help and appreciate your dedication to this board.
Okay, well, I too want to thank the Board of Trustees, management, the attorneys for coming today, answering the questions that were posed by the public. I want to also thank the audience. You guys were terrific. You're the ones that can make the difference. I urge you to please go to the trustee meeting on Friday. That's at noon, and you will be prepared for some public comment, I'm assuming. I think one of the things I've thought about a lot in the last 6.5 years is I'm not convinced that the county is running the hospital to its highest efficiency. And I guess at this time I'm going to go ahead and tell you that I asked our management to put out an RFP. You've heard that word before. To request a management firm to the commission to assure us that we are running the hospital in its best, highest efficiency. Because there's a lot of different ways a county can run a hospital. One of the ways is with, like we're doing now, there's hospital districts, there's a plethora of things out there that we could do. I don't know that we would change, but there you will see in the paper in the next oncoming time, and that was a decision I made, that we need to know if we're doing it right. So with that, if any other commissioners have anything, otherwise we'll...
I'll just add that I support that. I don't want you to be having to take that all on your own. I think examining our options is always a smart thing to do.
And I agree with that.
Thank you. So with that being said, I would take a motion to adjourn.
So moved.
There's a motion and a second to adjourn. Any discussion? Seeing none, all those in favor, signify by saying aye. Aye.